Anybody that knows me knows how much I love the outdoors. I love to hike, I love to fish, I love to hunt, and that was almost taken away from me about 6 years ago. I started having problems with my ankles. I put on a pair of boots one day and had this tender spot in my boots, and I just loosened the laces and tried to go about my business, but the problem just didn't go away. And I started to, do different things, experiment with different things to just ease the pain and discomfort in my feet. And I would leave the shoes loose. I had stiff soles. I tried to get my socks real loose, and if I did that, I could kind of ease my pain a little bit, but the pain never went away. I just hate to be in pain. I hate to talk about it. I really don't like to admit it, but I was changing my behaviors. I was sitting down more. I was leaning against things. I was just doing everything I can to alleviate the pain. And, being a doctor, I don't think I'm the best patient. So it took me a while to kind of figure out all this stuff. But I got to talking to Dr. Gipson one day, and he told me about some options that I should consider.
Yeah, so Andy came to me after seeing an orthopedic specialist who had recommended ankle fusion or joint fusion for his problem. He has degenerative joint disease in his ankle joint, and joint fusion used to be the gold standard treatment for that. There's nothing wrong with that treatment, except it does have some side effects. It locks up the joint. You have to fuse it by putting screws and plates over the joint. So it doesn't move, and that's how it treats the pain. It doesn't hurt because it no longer moves. But of course, with that becomes loss of mobility. You walk differently the rest of your life, and patients who have a joint fuse tend to develop arthritis in the joint either above or below that fusion site. So they're developing arthritis later on somewhere else. But looking and examining Andy and looking at his x-rays, I felt that he would be a good candidate for stem cell therapy. We take the stem cells from donated umbilical cord tissue that the mothers donate, and they are screened to be healthy and viable. And we take that, and in his case, inject it into the joints under fluoroscopy. And he had really good success with it. And we've been able to maintain his range of motion and take away his pain.
So Dr. Gipson was the chief resident down in the VA in Miami, and he specialized in foot and ankle reconstruction. And so I was confident in his advice and decided to follow that.
Well, I'm glad we were able to get you back out there. I know as an outdoorsman myself, I wouldn't want to give that up either. If you or any of your family or friends are having foot and ankle issues, arthritic issues, come down. We'd like to evaluate you and see if we can't get you mobile again and pain-free without having to have surgery.